Hi, my name is Ankur Gupta. I'm a general dentist in the Cleveland, Ohio area. I've been a dentist for about 21 years. And probably there is nothing more valuable for me as a dentist than photography. So I want to talk to you about photography today, but I don't want to talk about it the same way that I've learned about photography over the years. Here's how photography has always been taught to me is that you use dental photography as a means to document your beautiful cases. And so for the first several years of practice, I would bust out this really expensive, very high quality, sophisticated, and technologically advanced camera to really do a beautiful job of documenting an incredible aesthetic case or cosmetic case, something that I wanted to show off to other people, maybe put on my website, maybe use it in educational programming. And that was great. There's nothing wrong with that. But I was only using this super expensive camera like, I don't know, once a month or something like that, once maybe every 2 weeks. And not only was that a problem, my assistants just stayed away from that camera. It was too complicated. They didn't want to mess it up. And so what ended up happening was this camera was almost like a burden rather than a tool. But the problem was I kept on learning from a bunch of other dentists, like, oh, you got to do photography. You got to do photography. So I want to talk about photography today in 3 ways. Number one is the power of photography to get a patient to start emotionally connecting with their dental situation. And I want to start by talking about the power of extra-oral photos, meaning photos that are taken with a camera outside of a patient's mouth, and using extra-oral photos as a non-negotiable, mandatory part of every new patient appointment, every consultation, every emergency, putting the intraoral camera away and just getting a very nice, clear photo of a patient's dental situation. And in order to do that, you need, number one, is total simplicity, and number two is total consistency. So here's what I'm talking about. A patient comes in, let's say they broke tooth number 31. And what I would have done for years is I would have taken my intraoral camera, I would have taken a picture of 31, the broken cusp or whatever. Maybe I would have taken a picture of other kind of big, ugly, gross looking amalgams. And I would have showed, and then I would have taken a PA. And then I would show the patient that. And that's great, that's fine. No problem. Patient's probably very eager to put a crown on that tooth, and seeing a picture will just make them even more eager. However, let's say we were to just add to that protocol an extra-oral photo. So a photo of their smile and maybe a retracted photo of the front of their teeth. And then we put that picture up onto the TV screen in front of the patient. Patients sitting up there, they know they got their broken 31, but they're looking up at their overall dental situation. What do they see? They might see that their teeth have been subject to wear, bruxism, grinding, clenching, whatever, over the years. They might see, because the picture is, it's so clear, they might see that there's wear facets or fractures. They might see that there's an occlusal issue because teeth are crooked or they're all pushed in. And all of a sudden, instead of them thinking about 31, they're thinking about the big picture with their teeth. Now, I'm still going to focus on 31. I'm still going to fix the problem that they came in for. But now we have a much larger conversation to have. That patient is talking about, it's easy to transition into talking about how to avoid this problem in the future, how to maybe do more comprehensive dental work that'll make it so that that patient has a much greater degree of confidence that in the function of their teeth and the longevity of their teeth and the sustainability of their teeth. And that's all done because of one really simple step, and that's just taking a photo in the beginning. So earlier I said, all right, well, then take the photos, but they have to be, number one, simple, number two, consistent. And in order to do that, you need a camera that anybody in the office can use. We're talking about the least tech savvy person in your office. It's a camera that literally they just gotta, put their hands on it, point it at the patient's mouth and click a picture. And what you end up with is a beautiful photo that's focused from back to front to back. A photo that the patient can see their entire dental situation, but you don't have to mess with flash, with aperture, whatever size, with the length of exposure or anything like that. Every time that even the least tech savvy patient assistant in your office takes it, it's beautiful. And that's why I use the EyeSpecial camera by Shofu. There's no camera like it. This is a camera, any assistant can use it. It's super easy to add to the patient's imaging software, and you can wipe it with a cavi wipe or with whatever wipes that you have in your office. It's called the EyeSpecial. It's made by Shofu. Everybody should have it. Everybody should have it. You'll just do more dentistry. You'll do more comprehensive stuff. You'll do stuff that's more predictable. That's going to happen if you have the EyeSpecial. That's number one. Number two is I always like to use a camera, not so much for documentation, but more just so that I can confirm to myself that I did a good job. I want to share with you a little story. We had an associate dentist working at our office a couple years ago, and she was not confident with molar endo. And so I had a molar endo, tooth number 14, on my schedule. And she said, can I watch you? Can I watch you do the endo? And I was like, yeah, of course. So I accessed the canals, and I'm holding my little mirror in the patient's mouth. And I'm saying, okay, associate, look in the mirror. Look, you see? Do you see it? Both of us were like, wait a second, this is stupid. Why are we both hunkered over a mirror? Let's just grab the intra-oral camera and take a photo. And we took a photo, and sure enough, she was able to see what I was doing. But better than that, I was able to find a canal that I didn't know was there. Because an intraoral camera is going to give me way better magnification than my loupes are, even though my loupes give me really good magnification. And so an intraoral camera, I learned something that day. I realized that if I use an intraoral camera, not as a means of patient education, but just as a means of, hey, are you doing your job the best you can? All of a sudden, I will notice stuff that I would have otherwise missed. I'll notice voids. I'll notice decay that I didn't remove. I'll notice overhangs or lack of smoothness. I'll notice little areas of flash if I use an intraoral camera. So I started doing that. On a regular basis, I would, if I was doing a filling, if I was doing a crown prep, if I was doing endo, I would just grab the intraoral camera and just take a quick photo. And I would notice stuff. I would notice that I missed a little area of flash or a little area that needed to be smoothed off. I became a better dentist. Not because of experience or CE. I became a better dentist because I was just using a camera customarily. So there's a couple rules here. Number one, the camera has to be available in every single op. Super easy to just grab it and take a picture. So the camera has to be cheap so that you can have one in every op. It has to be cheap so that you have a couple spares. So if the camera breaks or something like that, you just have a spare one that's ready to go. And then number two, it has to be incredibly simple. I just want one button. I don't want to focus anything. I want to stick it in the patient's mouth, take a picture, and then bam, it shows up on the imaging software. I can see it on the screen. Patient can see it on the screen. Very easy to use. So the camera of choice for me is the Shofu EyeCam. It's because it's cheap. I don't know if it's the best camera in the market. I don't care. It is the least expensive. It has the best warranty, and it's super simple. One button. That means, again, least tech savvy assistant in the office. That assistant can use the camera. So 2 products that I feel like are indispensable for me, the Shofu EyeSpecial and the Shofu EyeCam. Use those. They'll make your life better.